Hi, it's Andrew Robb. I've just been involved with a 4-hour forum on, firstly, the first 2 hours on the problems that the young people are facing with mental health issues, in particular depression, and the afternoon session with senior members of the community looking at both the problems of depression and Alzheimer's. So the two sides of very big issues for our senior population, because we had a session which was so masterly emceed by one of our local heroes, Sally Cockburn, Dr. Sally Cockburn, Dr. Feelgood for some of those that listen to 3AW. But Sally did a wonderful job with the panel of experts that we had in both sessions to draw out of them what's happening, really what are the issues, where it's heading, and where the problems are. So I might get Sally just to reflect on one or two of the sort of major themes or observations.
Yeah, thanks, Andrew. I think that one of the major themes that came through was the need for a community response as well as a government response and a healthcare response, that really we need to offer support to young people and support to older people and listen to them. I got that message came through loud and clear.
Yeah, yes. I mean, other thing I found was the stigma, which really has caused this whole area of mental health to be sidelined for decades. It's being broken down, but it's still there. It's still there.
And because of people like you, Andrew, who stand up and tell their story despite what it might mean for them. And you're such a champion, and it's fantastic. We need more people like you who will admit that they have had issues and prove that you can go on to bigger and better things.
Well, that's the thing, is it can be managed or it can be beaten. And in most cases, I think over 80% or 90% of cases, you can either manage it or beat it. But the thing is, we have to really start to get far more resources into this, and it can be not only government but community resources, as you say.
And the linkages between local councils, people aren't even aware. Everything's fragmented, and we've got the fabulous, for the aged care, myagedcare.gov.au website. There's Beyond Blue, there's Kids Helpline, there's all these fragmented groups. But what we need to do is get some sort of pulling together of everything and losing the silos, I think.
Yeah. Well, it was a discussion which really did shine a big light on still the extent of the problem with seniors. It's really hidden from so many people. I think in many ways I noticed that there was a lack of mutual respect for what seniors have achieved in their lives, so they deserve to be listened to and recognised, but also what they've still got to offer. In so many cases they feel that their life is finished at a very early age once they retire, and that's reinforced by so many attitudes in the community and the general comments in the media, etc. There's so much we can do to make people feel worthy and worthwhile throughout their life.
I think it was also very scary to some of the statistics that over 50% of people in aged care facilities have probably got depression undiagnosed. And the thing that worries me is the number of people who may be on medication.
Yes.
And they've been diagnosed as having dementia, and they may not. They may have a reversible condition.
Well, just like young people, where if you get, I think 75% of depression cases start in the teenage years, so much easier to fix or manage at that stage than if you let it drag on into their 40s and 50s even, when it gets quite hardwired and unable to be dealt with in such an easy fashion. And the same thing with the elderly came through, or a variation of that, is that they've got, in many cases, depression undiagnosed because of other ailments they've got or other circumstances. If we looked for the depression, in many cases that can be managed and they could lead a much better life.
And I suppose, if I may, for your political colleagues, to say that the investment in youth mental health will be an investment for the future, because these are the next generation. But not to forget the aged as well, because it needs to be everything but investment in the future. I'm sure you'll do that.
I think that's a good note to sign off on. Thanks again, Sally.
Thank you, Andrew.
Thank you.